all the big names and all that. And we're going to be touching a bit on the new travel. You can just watch us on Facebook.
So as
right.
you were saying, yeah, the
Yeah.
COVID update. Did you have a good?
It went well. Everything went fine. Everything went
Okay.
fine.
Yeah,
Now, Dr. Steshni, first question I'd like to ask. Let's come to the United Kingdom, and we're being told that Omicron could be dominant in UK within weeks.
Yes.
So how many cases have we got so far as of this morning?
So 246. I think the latest news that I've read this morning was that we've got now 246. So obviously we started with quite a few number of cases, and it's gone up since the 23rd, 24th of November. It's gone up to 246, and the numbers could be rising.
This thing here, I would like to ask you, how can I tell that I have Omicron? How do you detect it?
Well, I think Omicron is detected, the different variant, isn't it? So the way they're testing is obviously they test for the SARS-CoV-2. And then once they've tested for that, they then obviously it goes to the laboratory and they do further testing and test for um, the variant, which is the Omicron. So the way and just some interesting just some background information on how they've actually named Omicron. It's according to the Greek alphabets. So you have the Delta strain, the Alpha, Delta, and the different strains. So yeah, it's according to the different strains.
Oh, I see. I see. To know that. Now, in the United Kingdom, so far, as of this morning, probably it's about 246. We that's what we're hearing, and probably it's more. Now, the interesting thing really is that a lot of people who have tested positive with Omicron don't even have travel history.
Yes. So I think, yeah, so it's difficult to say where people have got the Omicron strain from. But as you know, it was first detected in South Africa, and as a result of that, the UK has put bans on travel to South Africa. So it's an ongoing.
It really annoys me when I hear that. To be honest with you, I mean, it annoys me that I don't think it's fair in South Africa at all. They did a great job by detecting this thing. We should applaud them, not punish them. Yes. That's what I think. But it feels as if the whole world is targeting Africa, and probably Africa's got the lowest cases of Omicron as of now. Well, there's plenty of cases in the whole of Europe and different parts of the world. Why are countries from these parts not being banned from going into other countries?
Yeah.
Why does it have to start in Africa?
Yeah, that's true. It's still a concern, still question marks, and I think South Africans do feel that way. How come South Africa is being targeted? Because it was identified by the scientists in South Africa. And it doesn't mean that because the variant was detected there, that's the variant of that country. But if you look at it with the Delta variant, it came from India. So when the Delta variant came, then we were all talking about India and the Indian variant. So I think if we try to understand it in that sort of terms, I think then that makes sense, isn't it?
Yeah, but what about the UK variant?
Yes, well, that's it.
The Canton one, yeah, and all that. This these variants were found here in this country, and nobody's punishing the UK for that.
Yes, that's correct. That's correct.
You know what I mean?
I know. There's just so much going on with the Omicron, and I think they're saying that the symptoms that's associated with the Omicron, obviously we know that the SARS-CoV-2, the original COVID strain has mutated, and we had the different variants. So now the Omicron variant is a variant of concern because they are concerned that it can spread, it can be sort of spread quite rapidly. And as we've seen, we've already got quite a number of cases in the UK. It also can cause a reinfection. It can also cause more severe symptoms, they're saying. And the main symptoms to look out for is a increase in temperature, a fever, a new persistent cough. So they're talking about a scratchy type of cough or a persistent cough, and you can get the anosmia, so the loss of taste and smell. So these are still the main symptoms that we're looking at. So it's just a different variant, Apoku, but I think what people need to understand is just obviously we need to just continue with the precautions and what the guidance is. And having said that, just to reiterate, I mean, what they're saying in the news today is that more than half of the people infected with the Omicron variant are people that have been double jabbed. I know.
Yeah, I was going to ask that.
Yeah.
I was going to ask that. That people who've been double jabbed are getting it.
Yeah.
You know.
So, and that's why people are being encouraged to have the booster. So, yeah. So it's obviously still a concern. We don't know if the other concern with the Omicron is the treatment that's are available, whether it's going to be effective. And if we're hearing that people that are double jabbed are even getting it, obviously that's going to be a concern.
Yeah. It's just I don't know. I don't know what else to say or what you know.
I know, I can see, but I think what we should do is, I think the way
I
we
think
should
you can feel my frustration, can't you?
I know. Well, we've been doing this since the 22nd of February last year, so it feels like we just reliving it again. And but to be honest, I think the way I would approach it, and my advice would be, is we've been through this. We know exactly what we need to do. So we just need to adhere to guidance of wearing masks, hand sanitizing, social distancing, getting tested if you develop any symptoms, isolating yourself, and just taking care of your health and well-being. And I think that's so important. So I think this is, if we all adhere to this, and as we know, the UK. Boris Johnson and his team have brought masks compulsory now. So it is compulsory to wear a mask if you in any sort of shopping centers, any shops, traveling. So we do need to continue with wearing masks. And I think we just follow all these guidance, and we know where we've been before. We've all managed and we've coped through the initial first, second, third wave. And I'm sure if this is going to be the fourth wave or whatever we are in at the moment, we will all get through it. And I think it's about being sensible and taking care of yourself, and ensuring that you're keeping safe. And I think most people are listening, most people are wearing masks, and most people use hand sanitizers and maintain social distancing. But I think the concern with the UK and obviously with the rest of the world is, as we approach the festive season, where there's already so much of socializing going on, sorts of Christmas parties and school holidays, people will be traveling. So and then we need to remember the younger people and people that are immunocompromised and with underlying physical health conditions, and pregnant women. This will be the vulnerable group that they would be at risk. So we need to really take extra care if you are in contact with any of those groups.
Now let's talk about the UK travel rules now. Now from 4 a.m. up to 7th of December, that's tomorrow, isn't it?
Yeah.
Now everyone traveling to the UK will need to take a COVID test before their journey, as well as a test after they arrive. That we did that before they lifted it on in October. Now the government is introducing the measure as a response to worries about the Omicron variant, obviously, and it is also placing Nigeria on the UK's travel red list. We'll talk about Nigeria, but let's see what the rules are. Tests are required both before you set off for the UK and once you arrive. So before departure, that's from 4 a.m. on Tuesday, all travelers to the UK aged 12 and over will have to show proof of a negative test, even if they are fully vaccinated. Okay? Now, this can be at least so it's changed from 72 hours to 48 hours now. Now, private test providers must be used So free NHS lateral flow kits are not allowed. Okay. Now the test can be taken either in the country where you start your journey, or in another country en route to the UK if you're traveling that way. Until 4 a.m. on Tuesday, fully vaccinated passengers do not need to take a pre-departure test. Like the last time I was coming in, I didn't need to take a pre-departure test. But after arriving in the UK, you have 2 days to take a PCR test. The PCR test must be booked before you travel and bought privately from a government-approved list of providers. So it's like going back to the same old rules, before October when they lifted it. What's your take on this?
Yeah, well, I think, I know it's a bit of I can understand people's frustration and having to do this all over again, and understand your frustration. I think it's just something that we have to live with now, Opoku. It's not going to go away anytime now. So I think it's something that I think people have sort of prepared themselves over this year that we do need to have testing wherever you go in the world. And I think we've all been prepared for that. We had to. There's never been a rule where you didn't have to have tests done. So I think this is just now a continuation. So the way I see it is just a continuation of what we already know. And that's how it's obviously coming into effect. And just to make to be extra careful, because as you know, when we first started with the pandemic, December 2019, and then when we went into it in the UK in March 2020, February, March, we know that because of all the travelers and the traveling, that is when we had an increase in the number of cases, and a lot of people lost their lives. So I think travel is really one of those places where we cannot justify people getting infected because there's no restrictions and no guidance. So I think having this in place in terms of people being tested and also having tests done, I think is really important. Probably not the answer that you wanted, but yeah.
Yeah, well, that's right. I get it. It's cool. I get it. Let's go to the Nigeria situation, which I personally don't understand at all, because there are other countries around the world that are worse affected by the Omicron than Nigeria. I don't even know how many cases there are in Nigeria, but I suspect they're not that many. Why Nigeria has been added to the red list, I cannot comprehend. But the argument is that Omicron, definitely, that's the argument. Now, let me. I saw this article. I'm trying to find it to read it out about Nigeria being added to the red list, and there's a lot of protests going on around the world. People sending messages, especially from Nigeria and South Africa. So Nigeria has become the latest country to be added to Britain's travel red list, which imposes stringent coronavirus testing and quarantine restrictions on people who wish to enter. They will have to pay for and self-isolate in a pre-booked government-approved hotel for 10 days. It's like what was happening to travelers from India, during the Delta variant crisis. Now, 10 Southern African countries have already been added to the travel red list because of fears about the Omicron coronavirus variant. The government says the decision is temporary and will be reviewed in 3 weeks. And the travel industry has described the changes as a hammer blow. There's concern that Omicron could spread quickly and even replace the Delta variant around the world.
Well, they are warning us. They are warning us, and I think Nigeria, obviously, it's unfortunate. Nigeria is number 93 in the world. So they've got 214,622 cases with 2,980 deaths. So they're actually quite, they've done really well. So it's a bit of a surprise. I understand exactly what you're feeling, but we just have to go with what's happening. And I think we're just being warned, Opoku, about the Omicron variant and about everything that's going on in terms of the variant and about the spread. And I think people just need to just adhere to the guidance, make sure they're taking care of themselves. And if you're not vaccinated by now, you do need to get vaccinated, get the boosters, or get the first and second jab. So I think that's what everyone's being urged to do.
A friend of mine phoned me last night from Lagos, Nigeria.
Oh, okay.
Yeah, I was talking to him, and he said, and I know he's supposed to come back. He lives in the UK. He's supposed to come back on Tuesday. Okay. So he phoned me, and he said, I'm at the airport right now, trying to get flights to the UK before the red listing sets in. Yeah. No flights at all, because some of the flights have been cancelled. So he had to, as a matter of necessity, because he's got his family here and he's got stuff to do. As a matter of necessity, he had to fly to Accra last night and get on a plane. And he's arrived this morning, actually. He's phoned me to say he's arrived. He's at Heathrow. And I'm thinking that it's extra expense, isn't it? Because you have to fly to Accra and buy a new ticket so to be able to get here and all that. But saying that, I think it will be much cheaper than paying all the 2,000 and something pounds to quarantine in a government approved hotel and all that. And that's the frustration. And I think it will really affect the travel industry in the UK, because the number of flights that go to Nigeria and the number of Nigerians who fly in and out of UK is unbelievable.
I can imagine. I mean, there is quite a lot of flights. It's exactly like South Africa, where there's a lot of UK has a large number of flights going to South Africa, going to Nigeria. So obviously, it's going to impact on the travel industry and on tourism. And obviously, people that are traveling to and from Nigeria, because there's a lot of businesses. So business people that are traveling. So it's unfortunate about what's happening, and your friend about the flights and stuff. So
I was so glad when I got his call this morning, and it was a WhatsApp call. So I was thinking, oh God, he's probably still stuck in a crowd. And then he said, oh, I'm at Heathrow right now. I'm going through passport control. I said, yeah.
Oh, that's amazing.
But
that's amazing news.
I can imagine what he would have gone through if he hadn't made that move. You know, with his family and his kids here, and
Well, I think that's his story is a warning, and actually, it's about planning. I think we need to be prepared for anything in what's happening at the moment, especially with when South Africa's flights were banned from the UK. Because I know a lot of friends and family, work colleagues, all their families could not come to the UK, or they had to cancel flights. They couldn't go back to South Africa. So I think what that taught me is that, and what's hearing about your friend is, you really need to plan wherever you are right now. You need to think about where do you want to be for Christmas and New Year's, and make your plans, and try and get to that destination so that you are with your family and your loved ones over the Christmas and festive season. Because I think the last thing you want is to be alone on Christmas, and also because you're not able to travel. So it's obviously affecting a lot of people at Poku. The stories we've heard from friends and families, only a few. There's so many people being affected.
Traveling has become really difficult, hasn't it?
Yeah.
And for some of us who have to travel to work, that,
I know.
You don't know what's going to happen.
Yeah.
When you go, and then, like the typical example is my friend. If he hadn't made that move, then he'll be stuck in Nigeria, or he would have to pay that amount of money. What if he didn't have it?
Exactly.
So it's just.
Yeah. And I think some of the countries, as we've spoken about with South Africa and those some on the red list, they have to quarantine when they come back into the country. So
they do,
they have to have the testing. So it's a lot of additional costs. So I think whoever's traveling, I mean, obviously if it's an emergency and you have to go for emergency leave, emergency families, someone's not well, then you do need to go. But otherwise, people do need to plan and think carefully about where they are going to. It also brings to mind, about lockdown. What is the prediction? Are we going to go into another lockdown or not?
I don't want to say it, but I believe so. Okay. I really hope to God I'm wrong.
Yeah.
But the way things are going, I'm a bit afraid that that's what's going to happen.
I think you might be correct, but I'm hoping that with the precautions and the guidance that the government is giving and the action. They're being more proactive in their approach in order to manage the risk and the numbers. I think it's because they've done that and they've started out a bit early. I think that we might be okay for Christmas. But having said that, there is a possibility we could go into
Yes,
lockdown.
I've heard it. I've heard it. It's this rumors going around that we might go into some sort of lockdown probably for a couple of weeks.
Yes. So
Yeah.
I think we sort of need to prepare ourselves and just make sure you start shopping early, getting all
You
your
better get your turkey
shopping.
now.
I know your lamb, your gammon, roast
The
turkey,
gammon, all that. Get them ready.
all the Christmas trimmings, and and your Christmas tree and presents. Just get them all early because you don't know what's going
We
to
don't
happen.
know. We don't know what's going to happen.
Exactly. So
I just pray to God that we don't lockdown thing. We're tired, aren't we?
I think lockdown, Apoko, might be sort of something that they would think about and they'd sort of say, we will go into a lockdown if this doesn't happen. So I think if everyone listens and people adhere to guidance, for me, I felt, and I was discussing this with one of the taxi drivers the other day. Do you know the taxi drivers have so much of knowledge? They're listening to
taxi drivers and hairdressers.
Yeah, I know. They listen to all the radio shows and they have so much of information and knowledge about the COVID, It's absolutely amazing to have conversations with them and to talk about it and the knowledge. And they started wearing masks as soon as the guidance came. You have to wear masks. They've all started wearing masks because obviously their professions put them in a high risk. But having said that, so what I was trying to say is one of the taxi drivers in that I went to work the other day because my car's not fixed. I'm still using the train to commute, and so he predicted that we might go into a lockdown. Exactly what you said, but he said it might be in January. So I don't know. So maybe we might not go into lockdown right now, but I think why he probably said that, and we discussed it, is probably after Christmas and after everyone has mixed, then I think the numbers might increase, and then that might result in us going into lockdown next year, which is highly possible. So I think my I don't know what your feeling is. Should they bring the social bubbles back in? So in terms of how we had it last Christmas where we had to only mix in our bubbles? I felt that now already, in order to prevent an increase and to prevent another sort of another like wave where there's lots of infections and lots of deaths, they should actually bring the social bubble, or people themselves should just start creating their own social bubbles and thinking, okay,
social bubbles,
I'm only gonna, so from now till Christmas until New Year, this is the bubble that I'm going to be in, and I'm not going to be mixing with other people out of my bubbles. What do you think?
I agree with you. I agree with you. I think I think that they should bring back the social bubble thing, at least for some time.
Yeah, because as it stands, I mean, I'll be working till just before Christmas, the week before, and we're going to be mixing, going to hospitals, mixing with other people. Then obviously over Christmas, seeing family and friends, and how they would have been in contact with other people, and some of the other people might be working in hospitals, also exposing themselves. And it's not just in hospitals that people are getting it, they're getting it from traveling, from workplaces, from schools, from universities and colleges. So it's, everyone is at risk, and everyone that's mixing and socializing would be at risk. So to be honest, I do think they should have brought the social bubbles in order to prevent a lockdown, and also to prevent any further spread of this Omicron.
Right, let's round up now. Let's get them out.
I've got the numbers, so I'll just refresh the page just because I had it open for a while. So as of the worldometer, as of today, it's the 6th of December, and it's the number of cases worldwide is 266,215,281 positive cases around the world. No, total number of deaths as of the 6th of December 2021 is 5,273,301 deaths, and total recovered is 239,862,487. And then the total number in the top five countries, we have USA number one with 49,969,856 positive cases, with 808,763 deaths. India number two with 34,641,561 positive cases, with 473,537 deaths. Brazil number three with 22,143,091 positive cases, with 615,674 deaths. UK number four with 10,464,389 positive cases, with 145,605 deaths. And Russia number five with 9,833,749 positive cases, with 282,462 deaths. And then coming to South Africa is number 18 with 3,031,694 positive cases, with 89,966 deaths. And in terms of, we'll go to Ghana. I'm just getting Ghana's number 106 in the world, with 130,920 positive cases and 1,209 deaths. And I did do Nigeria earlier on. And then we'll just go into the UK 24 hours, because obviously UK, we're still seeing a large number of cases in the 24 hours. So 24 hours is 54 new deaths, with 43,992 positive cases. So it's still quite high. So it's been ranging. So the day before was 127 new deaths, with 42,612 new cases. The day before that, 143 new deaths, with 49,884. So yes, I mean, so it's obviously still a concern.
Yes.
And hopefully, I mean, if everyone just keeps safe, spread the love and not the virus, and get your boosters, get your vaccines, and just do your testings, lateral flow test or PCR testing as required and indicated, and as per guidance. Yeah, thank you, Apoko. I just wanted to say it's my dad's heavenly birthday today. So
happy birthday, Daddy.
Yeah, so just remembering him today, Dina
Yeah.
Happy Mudlia. So he passed away 13 years ago. But this was his birthday, and yeah, so we'll be having a heavenly, observing his heavenly celebration.
May his soul rest in perfectly.
Thank you so much.
And I'll talk to you later, Dr. Sessions. Thank you very much for joining us on the show.
Yeah, and enjoy your day, and stay safe wherever you are. Thank you so much.
Yes.
Lots of love to everyone. Bye bye.
That was bye. That was Dr.